How you doing? Can you hear me okay?
I can. Can you hear me okay?
I can hear you.
Okay.
Still no haircut, but it still looks good. So,
It's getting more and more wild. Boy, I need a haircut.
so okay, let's get right at it. I'm in the media. You're the mayor of Brampton. It's just sheer confusion in regards to vaccine rollout. So let's try to clear the air here. 18 plus vaccination starting for registration. When does that start for Brampton?
Let's start on May 4th. And let me say, first of all, this is exactly what we've been lobbying for. So I am really relieved that our calls have been heard. The Ontario Science Table said that to beat COVID-19 in the hotspots, we need a 50% allocation and needs to see the age threshold dropped. And we got that. So credit where credit's due. The provincial government came through for us on this. The average age of an essential worker in Brampton is 36, and so when we had an age cutoff as 45, it wasn't really helping us on the front lines. And so I'm really relieved that we're going to start to get that help. You focus the resources where the pandemic's happening. You focus the fight where the fire is, and we finally got through to the province. And so I was a pretty happy camper yesterday.
I'll give you credit where credit's due. You are all over the tube, and you are waving the flags for Brampton for sure. So 18 plus can now register May 4th on the Ontario portal. Is that correct?
Correct.
Okay. And then once you register, do you know when they'll get poked?
Well, because we're going to get a big enhancement in vaccines. In the first 2 weeks of May, we're going to have 19% of the total provincial allocation. That means there's going to be a lot more appointments. It still may take some time to get an appointment, but we're going to have more availability than we've ever had before. Ever.
Good.
At one point, we had 6% allocation of the provincial total, and we were 10.5% of the population. Now we're going to have almost double our per capita allocation in the first 2 weeks of May.
Good. I know there's Dr. Lowe mentioned this week in one of his pressers that there's going to be the 18 plus mobile pop-up in Brampton coming next week. Do you know anything about that?
So there's a number of pop-ups, 13 of them to be exact, but you don't need to depend on a pop-up because you can now use the mass vaccination centers for 18 plus. So just view those pop-ups, view the mass vaccination centers as giant pop-ups. Where the pop-ups were really useful was in some cities they had small segments of the community that had high rates, and so they would create pop-up clinics in those aberrations within their community. In Brampton, it's a little bit different because the entire city is a hotspot. Yeah.
So, but there is still going to be the 13 pop-ups next week then.
There's still going to be the pop-ups as planned. There'll be more pop-ups, but in some cities you can only do 18 plus at a pop-up. Now you'll be able to do in Brampton pop-ups. You can do 18 plus at the mass centers or the pop-ups.
Okay.
And the way I give this analogy is previously it was only boarding for certain passengers. And so it's that, at the airport, and it's like that we're calling, this rows 1 to 3. Right now it's going to be general boarding in Brampton starting May 4th. Everyone is welcome to come over the age of 18.
Good. One thing we've known about the feds and the vaccine rollout or the vaccine procurement is that they've overpromised, underdelivered. Are you afraid that this, kind of the presser that the Ontario government said yesterday, everybody by May 2-4 throughout Ontario, 18 plus will be able to register? Are you afraid that might not happen?
I think it's very achievable, but everything is dependent on vaccine supply because we don't have domestic production. If all of a sudden an order got canceled to Canada, that would put us in a precarious position. But I would say right now, for the first time, it's looking more positive.
Good. Who can get vaccinated right now, like today?
Well, right now it's still the official threshold is 45 and older, but that will change dramatically on Tuesday.
Viewer question we have here: when can transit essential workers get vaccinated? I guess
Tuesday. Yeah, everyone. General boarding starts May 4th.
Okay. I know both of you and I are Team AstraZeneca. Do you think that we'll be able to get the second dose sooner than 4 months?
They haven't given us any information on that. I believe that we should have a closer period. I worry that the 4-month period won't have the same safety protections as were researched in the clinical trials. So I worry when we deviate from the recommended advice from the clinical trials, but ultimately this is the current advice of the National Advisory in Ottawa. There's talk that this might get revisited. I hope it does. I've heard concerns about the delayed second dose.
And I also read too that there might not be any AstraZeneca by the time we have our second dose. So have you heard about that?
No, I know there's some concerns about procurement from India right now because they're in a major they have a major challenge. But you know, there are other sources for AstraZeneca in Europe and the United States that Canada would be able to procure.
Okay, so after 6 weeks lockdown, May 20th, where do you see Brampton opening up? Red, gray zone, patio?
Well, we're going to hear from the science table on that. I don't think we should be, as politicians, making predictions now. I wouldn't want to get expectations out of line. I hope that the science table recommends that safe activities are allowed. Hopefully by that point, we're going to have high levels of vaccination in Peel region that will change the ballgame. You know, Dr. Lowe has said he can see us getting to herd immunity very soon. So that will, you look what happened in the States when they got high vaccination levels, it dramatically changed the dynamic. And so I'm hopeful we're going to see that in Peel region soon too.
True. You're one of the first mayors to call out for sick pay. This week, the province announced some kind of sick pay benefit program. Are you satisfied with what they've announced?
I want to recognize progress. Progress is good. 3 paid sick days is a tool that we can use that will be helpful. The enhancement of the federal benefit is helpful. You know, I don't want to look down at a $2 billion investment. They put $2 billion on the table. You know, would I like more paid sick days similar to the Yukon or other countries? Absolutely. But is this going to help? Yes. Do I appreciate the provincial government change course and listen to the science table and is now giving us this important tool? Absolutely. And so, you know, I acknowledge governments when they listen. I acknowledge governments when they put resources towards an important pathway. And as Dr. Lowe has said, this is going to help us.
And I know you're an outdoor activities type person. Have you heard anything from the province in regards to opening up tennis courts, basketball courts, playing golf?
Well, I've spoken to the Premier and to several senior ministers, including the Finance Minister, Peter Bethlenfalvy. I get the sense that they're very sympathetic to the need to adjust on outdoor amenities. So I'm hopeful that change is coming. The science and the data does not support closing outdoor amenities. It simply does not. And so I am optimistic that logic will prevail. I think it is a significant concern that we are going to further trample on physical health, on mental health with the closure of these public spaces. So I'm going to continue to be aggressive in my advocacy for the opening of outdoor amenities. As long as the science table and our physicians say that outdoor amenities are safe, I don't want to take that away from a public that has already had one heck of a year.
Have you guys given out any big tickets or any, you know, we heard about, you know, a poor bylaw officer getting coffee thrown at him this week. I mean, anything happen?
Yeah, so we continue to see a high level of compliance where 99% of the city understands the seriousness of COVID-19. They listen to the public health advice. We had one incident where there was I think a social gathering with 14 people that they faced fines. There was an incident where someone threw coffee at a bylaw officer. But overall, we continue to see a high level of compliance.
Good. I know this isn't your jurisdiction, but do you see schools opening back up for in-class learning by the end of the year?
I'm hopeful.
Okay.
I think there's a real cost to being away from your peers, being away from learning. Online learning is not the same. So I'm hopeful that we'll get the numbers down far enough that public health would feel comfortable with kids in school.
And I guess let's just, end with a positive thing. I mean, like, by the end of, let's just say, if the vaccine rollout is correct and everybody's vaccinated by the end of June, do you see possibly festivals and events happening maybe September, October in Brampton?
Well, if you look at how they've adapted in New Zealand and Israel and other countries where they've had a high level of vaccinations, even some of the states in the US right now, yeah, it enables festivals and events again. Everything is possible once you have that high level of vaccination.
True. All right. Well, Mayor Brown, thank you so much. By the way, our live chats have exceeded 2.5 million views over the last year.
There you
So
go.
just letting you know.
So.
All right.
Okay,
so thanks so much. I'll catch you next week.